In the next part, we'll talk about some of the skin manifestations of allergic disorders. The first is mastocytosis. So, this is a rare disorder and it is characterized by abnormal mast cell proliferation and accumulation in various organs. Degranulation of the mast cells and histamine release can cause symptoms, and the tissues that are involved determine the degree and the severity of symptoms. Mastocytosis that's limited to the skin is called cutaneous mastocytosis and is a result of increased mast cells proliferating in the dermis itself. You might see a fixed flesh or yellow colored lesion, and that's known as a mastocytoma. Children can have one or more mastocytomas, and some children will have multiple flat, brownish tan lesions that result from both a proliferation of mast cells and melanocytes, and that's known as urticaria pigmentosa. Lesions usually appear in the first year of life, and they're usually limited to the skin. If you gently stroke one of the lesions, you'll cause a wheal, and this is known as Darrier sign. On the other hand, systemic mastocytosis is caused by mast cells that are in extracutaneous tissues like the bone marrow, liver, and these patients have systemic symptoms. They might have abdominal symptoms, flushing, fatigue, hepatosplenomegaly, and they are at risk for anaphylaxis. Labs will include a CBC, where you'll see cytopenias or abnormal leukocytes, liver function tests to assess for liver involvement, total serum tryptase, which is a byproduct of mast cells and is elevated with most systemic disease. You may also need a really good skin exam with potential biopsies of the lesions, as well as bone marrow biopsy if there's any evidence of malignant involvement. There is no curative therapy, but avoiding environmental and dietary triggers can really help. People should also avoid heat, cold, alcohol, aspirin, and opiates. Antihistamines are used to control symptoms, and oral cromolyn can help with GI symptoms. There is an aggressive form that may require interferon, immune modulators, or chemotherapeutic agents to keep symptoms under control.